incentivised. I don't have the details at the moment, but I can commit to Right Honourable Baroness.
My Lords, the first paragraph of this statement says it outlines the preparations being made so that health and social care services remain resilient and available to patients. How, then, does that square with the fate of the residents of Barclay House in Kent, which was home to adults with severe learning difficulties and autism, who were told at 7:30 a.m. in the morning that they would have to leave by 5 p.m. that evening? Among them was one resident who had to be sedated to ensure that they could safely be moved. Now, Barclay House is owned by Achilles Together, which is one of a chain of companies registered through the tax haven of Jersey, and ultimately appears to be owned by AMP Capital, and a global investment firm based in Australia. How does providing a resilient and available social care system line up with homes like this being run for profit, not for public or the residents' good?
What we have to recognise is if you look at the social care system, there are an awful lot of private providers. And quite often when you look at the private providers, it's the private patients who subsidise their ability to provide places for state-funded patients. So, and if you look at our health system overall, our system of healthcare, there's always going to be a mixed economy. There will be a state provision. Lots of our GPs, for example, are partnerships. They are not state-run. They are cooperative. Some of them are even for profit. And so I think when you look at the overall health system, there will be a general balance. But in terms of the particular case, I'm not aware of the particular case, so I thank the Noble Baroness for raising it. But one of the things that we are committed to is making sure that we do improve services, and whether that is state-funded or private, as part of the overall system of healthcare that we have in this country. And clearly, where there are providers who are not providing a service, there will be CQC and quality care and other assessments to see whether they are fit or not.
COVID-19 is